Hello dear students, this is Mushtaq from MC Society Institute of Pharmacy, Azam campus. Today we are going to learn about metabolism of drugs. Outcome of this today's lecture: the student will be able to define the terms drug metabolism. The student will be able to state the sites of drug metabolism. Students will be able to describe the process of phases of drug metabolism. Student will be able to explain the types of metabolism enzymes, and the students will be able to explain various factors affecting drug metabolism. Starting with, drugs are normally treated as foreign substances which the body always tries to eliminate it. So normally we take the drug in a specific dosage form like tablet, capsule, syrup, etc., and from a specific route like oral route, parenteral route, etc. With few exceptions, all the drugs are eliminated from the body in the form other than in which they are administered. Means if you are taking the drug by oral route and in the capsule form, the drug will not be eliminated by oral route, it will be eliminated by urine route or by fecal matter route. But the form will also be changed. The drug will be eliminated in minute quantity after metabolizing, and the form will be in dissolved form, not as a capsule form or tablet form. So definition of metabolism: so the chemical changes that the drug undergoes in the body are known as biotransformation or metabolism. So there will be some structural changes which occurs in the drug structure in the body is called as biotransformation. The main site of drug metabolism is the liver. Other tissues also metabolize drugs like GI tract, kidney, lungs, brain, etc. But the major or main site is liver. Next, coming to the phases of drug metabolism. The drug will get metabolized in two phases, that is called phase 1 or non-synthetic or functionalization reactions, and second one is phase 2, that is also called as synthetic or conjugation reactions. What happens in phase 1 means the drug will undergo reactions like oxidation, reduction, hydrolysis, etc., and in phase 2 there will be combination of drug with small molecules like such as glucuronic acid, such that it can be easily eliminated from our body. So we'll see an animation.
The epithelial cells and into the bloodstream, where they are carried around the body. Distribution. Blood plasma contains complex molecules called albumin. Albumin is a protein made by the liver which transports nutrients around the body. Albumin also binds to drugs that enter the bloodstream. Here you can see some of the aspirin molecules binding to the albumin. All the aspirin particles that have been bound will be filtered out as they pass through the liver, and only the remaining aspirin molecules will get through and have any effect on the body. Different drugs will bind to albumin in different amounts depending on their affinity for plasma protein. The next stop on the journey is the liver. The aspirin-rich blood will enter the liver through the hepatic portal vein at the bottom, and it will exit at the top via the hepatic vein. At this stage, even more of the aspirin will be removed through a process called first-pass metabolism. The liver's job is a bit like a filter. It will metabolize drugs before they reach the rest of the body. It does this in a few steps. Phase 1 metabolism. First, aspirin is hydrolyzed, breaking off ethanoic acid and leaving behind salicylic acid. This salicylic acid isn't water-soluble, so it can't be excreted in urine yet. Phase 2 metabolism. An ionized group is then added to the salicylic acid, forming glucuronide, which is water-soluble and can be excreted in urine. A lot less of the aspirin will continue its journey onto the rest of the body, including the site of the pain. Only 68% of orally taken aspirin will have any effect at all, because of all the filtering that the body has done. This percentage is called the drug's oral bioavailability. If drugs are not administered orally, e.g. intravenously or buccally, then they can bypass the small intestine and liver, so none of this filtering takes place, and they have 100% bioavailability. We are now at the site of some skin tissue damage. Tissues in the skin are creating prostaglandins, which are causing inflammation. The prostaglandins are sending messages to the nerves in the skin responsible for the sensation of pain. Once the aspirin arrives in the blood supply at the site, it prevents the production of prostaglandins in the tissue, which will reduce the swelling and stop the messages being sent to the
So we have seen the animations of showing the two reactions, that is phase 1 in which we add a polar group, and second one is that phase 2 reaction in which we are adding a polar group such that drug will eliminate easily from the body. So first phase 1, what happened in the phase 1, as we seen in the animation, the most important function of the biotransformation is to convert non-ionized lipid soluble drugs into more polar water soluble compounds so that their elimination through urine is easy. So our main target will be to make the drug water soluble. So normal reactions which takes place are oxidation, reduction, hydrolysis, in which polar group into drug serving this purpose is added, like a functional group. So from here we got a concept known as prodrug. So what happens in the prodrug? So we give an inactive drug, it goes to the liver, and because of the first phase metabolism it gets activated and show its action. So as we know that although metabolism of drugs tend to stop the pharmacological activity, it is not correct to think drug metabolism as detoxification process. So that's why we have introduced the concept of prodrugs, in which inactive drug is metabolized to active drug, for example cyclophosphamide, castor oil, phenoxybenzamine, etc. Alternately, an active drug can be converted into one possessing more toxic action or different actions. Example is parathormone converted into toxic substance like paraquat. So for normal drug there will be oxidation, reduction, hydrolysis, which forms the inactive metabolites. These inactive metabolites will get conjugated in phase 2 reaction and excreted out of the body. In some cases the active drug after oxidation, reduction, hydrolysis will form a more active product. This active product will again goes to the phase 1 reaction, that is oxidation, reduction, hydrolysis, and then forms inactive compound and then conjugated with the any small moiety present in our body and get excreted. So first is direct excretion after phase 1 reaction. Second one is the phase 1 reaction will leads to more active compounds. Again these more active compounds will goes in the first phase and then forms inactive. And next concept which I told you earlier, that is prodrugs. They go undergoes oxidation, reduction, hydrolysis and forms an active compound. This active compound again can goes to the phase 1 reaction and forms inactive metabolites and then conjugation and elimination. In many cases the drug will be directly excreted without going any structural changes. That is, the drug is excreted in a free form without any oxidation, reduction and hydrolysis. This is called as free form, that is metabolism, in which the drug will not go any under control, that is structural changes, and then it will be eliminated. In some cases the active metabolites can goes to the directly to the phase 2 conjugation and get eliminated. So benefits of prodrug: more stable, there will be more bioavailability, less side effects and toxicities. So there are many prodrugs which are activated selectively at the site of action instead of activating in liver, they are activated in the at the site of action. So we know that a drug which is lipid soluble will absorb very good, but for a good elimination there are lipid the drug should be more water soluble such that the elimination will be good. What happened in phase 2 reaction? As we seen in the animation, there is a conjugation or synthetic reaction involving a coupling of a drug or its metabolites formed in phase 1 to another chemical group like sulfate, acetate, carbohydrate, amino acid, etc. And the reactions are called as gluconide conjugation, acetylation, methylation, etc. And the end products which forms are more water soluble and can be easily eliminated in bile or urine. Since it is a conjugation reaction, we requires very high energy, as we see in the animation. So the phase second reaction can also occur without pyrrhia of the phase 1 reaction like oxidation, reduction, hydrolysis. It is suitable grouping pre-exist on the molecule. Just I have explained you. So again we can see here drug, it can be excreted in a free form without undergoing any metabolism, or a phase 1 or phase 2. In a second form, the drug will undergo a phase 1 and forms a metabolite. Again, this goes to the phase 2 and form a metabolites, and coupling of the metabolite with the small molecule present in our body and get excreted. In some case, the drug may eliminate directly by the phase 2 reaction, that is by coupling with the small end product molecule present in our body and get excreted. So by any of these mechanisms or by one or more mechanisms, the drug will leave the body. So then the enzymes which are utilized in phase 1 and phase 2 metabolic reactions are divided into two types, that is microsomal enzymes and non-microsomal enzymes. First we'll see about microsomal enzymes. So we know that in our cell we have a part known as smooth endoplasmic reticulum. So there are a lot of enzymes present in the smooth endoplasmic reticulum, and these enzymes are called as microsomal enzymes. So they are located on smooth endoplasmic reticulum in liver, kidney, intestinal mucosa and lungs, and it contains many enzymes. Few of them are monooxygenases, cytochrome P450, glucuronil transferase, etc. They catalyze most of the oxidation, reduction, hydrolysis and glucuronide conjugations. So microsomal enzymes are induced by diet, drug and other agents. The second category is non-microsomal enzymes. So they are present in cytoplasm and mitochondria in hepatic cell as well as other tissues including plasma. Examples of these non-microsomal enzymes are oxidases, erastases, amidases, gluconeogenesis, etc. They normally catalyze some oxidation and reductions and many hydrolytic reactions and all conjugation except glucuronidation. So they are helping conjugation usually used for phase 2 reactions. And next is factors affecting drug metabolism. So first one is age and sex. Second one is genetic determinants like there will be hypersensitivity and drug resistance. Third one is nutritional status. Fourth one is route and duration of administration. Fifth one is simultaneous administration of other drugs like enzyme induction and enzyme inhibition. And the last, presence of disease, that is hepatic or renal damage examples. So first of all, age. Coming to the age, the infants, they lack many hepatic enzymes, so the drug will not get metabolized in the infants, that is below 1 year age. So our we cannot give the drugs to the children or infants. Why? Because they will not get metabolized and show toxic effect. So one factor is age, and same thing with old age peoples, they will also not able to metabolize the drug because of the age factor. Next is sex. Many drugs are easily metabolized in males as compared to females, because of the females undergo many life changes like lactation, pregnancy, etc. So at that time we cannot able to give the drugs because there will be alteration in drug metabolism. Next factor is genetic determinants, means there will be presence of certain set of genes which may cause reaction, that is hypersensitive reactions, that is also called as adverse drug reaction. So these people, when we take, if they take the drug, they show an adverse reaction which is non-beneficial and harmful because of presence of that set of genes. And some people have a set of genes which, by which they may get the enzymes which metabolize the drug because of the presence of that set of genes. So because of this, how much the amount you take the drug, it will get metabolized and there will be no effect, that is drug resistance. Next factor is nutritional status. A good healthy diet and proper electrolytes intake will help the liver to metabolize the drugs. So if there is a deficiency of nutrition, and the liver will not function properly and there will be not much metabolism of the drugs. Next, route and duration of administration. So the drugs which are taken by oral route are metabolized more amount as compared to drugs which are taken by IV route. And if you are prolonging the drug duration, it may alter the metabolism. Next, presence of other drugs. Some drugs may increase the activity of metabolizing enzymes. Some drugs will decrease the activity of metabolizing enzymes. The drugs which will increase the activity of metabolizing enzymes will lead to faster metabolism of the drug, and that there will be low action, slow action, as well as the duration of action will be less. If there are certain drugs which will inhibit the enzyme, because of enzyme inhibition the drug will not get metabolized, there will be high concentration of drug in the blood, and which leads to toxic action, as well as there will increase in duration of action. Last, presence of disease. If there is a hepatic damage, a cirrhosis of liver, the liver will not function to the maximum, and this leads to non-metabolism of the drugs. So same thing with renal damage, there will be no metabolism of drugs, and because of not metabolizing of the drugs, there will be increased concentration of drug in the body, which leads to toxic effect as well as increased duration of action. So what we have learned? We have learned that there will be structural changes of drug in the body. This is called biotransformation. The main site of biotransformation is liver, and the biotransformation occurs in two phases, phase 1 and phase 2. And the enzyme system, we have two enzyme systems, that is microsomal enzyme system and non-microsomal enzyme system. After that, we have seen the various factors affecting drug metabolism. Thank you.